I have a couple stories that I want to hit on. One of them is, after our conversation about the CJ yesterday, I was kind of like, okay, we've let them know what's up. We've let them know what's what. We've let them know how we feel. Then today, I wake up, front page of the newspaper, huge story and headline about nursing homes and their grades in the Commonwealth of Kentucky. Now, normally, you would right away think, well, that's good to know, good information, that a lot of our nursing homes are not average. They're below average in the Commonwealth. But see, you got to look deeper than that. Why that story, why now, is what you have to ask yourself. And I don't want to have another long conversation about CJ's bias, but this is such a perfect example that I have to point it out. There's a bill that just passed out of the Health and Human Services Committee in Frankfort that would install some sort of tort reform that would prevent nursing homes from just being the victim of attorneys who are phishing. You've seen the ads. If you or a loved one have died as the result of care in a nursing home, you may have a case. Give us a call. Now, I am not anti-lawyer. I'm not even anti, that kind of lawyer. Because if you really have a case, if you really have a problem, if someone has mistreated and abused a loved one, then heck yeah, you better have the right to sue. But we also have to recognize that home or health care for the elderly, specifically nursing homes, assisted living facilities, those things, it is very expensive already. It's very expensive already. And when you put in malpractice insurance that is skyrocketing because of this new focus on nursing homes as a source of money for plaintiffs' attorneys, it jacks the cost of care up even more. And it has a diminishing effect, meaning that one of the reasons that some nursing homes give worse care than others, substandard care, is because of staffing issues. They don't have enough staff for the number of people they have. They don't have enough staff to give the proper care and attention to the people. That is a legitimate complaint. But when you have to spend more money on your medical malpractice insurance, where are you going to cut? You can't cut food. You can't cut things like linens, beds, and towels. You cut the highest expense you have, and that's labor. So there has to be a balance. There has to be a balance. And the story in the Courier-Journal's front page came at a time when that bill is being debated. Does anyone think that's a coincidence? Anyone? Anyone? Just a thought. Just a thought.